What's going on, guys? Joe here again. Today we're going to be talking about outpatient nurses, what they are and what they do. Alright guys, if you haven't seen it already, I do have a top 9 highest paying nursing jobs, and I'll link that up here at the top. What I did a little bit different than some have done in the past with that video is I broke it down based on what degree you have or will have. The 3 highest paying jobs as an ADN, the 3 highest paying jobs as a BSN, and the 3 highest paying advanced practice degrees. So go check that out if you have a second. Now let's recap. What we're talking about right now is an associate's degree in nursing, and we're talking about outpatient nursing after you have your ADN. Now your license itself is the same. It's still a registered nurse license, but the amount of school that you've gone through is a little bit different, okay? So this is essentially 2 years of prerequisites, 2 years in your nursing program, then you take your national NCLEX exam, and you have your RN. Today we're gonna be talking about outpatient nursing, and a little bit about what they do and what to expect in an outpatient scenario. So the first thing I want to talk about is, what is an outpatient nurse? So an outpatient nurse is technically a nurse that works in a clinic that is designated for outpatients. So things like cancer clinics, or when you go see your PCP for a regular checkup, or you go for a sports physical, or whatever the case may be. When you're going to see that doctor on an outpatient basis, meaning you're just going to visit them and then you're going home, you're not having to stay anywhere, a lot of those doctors operate in outpatient clinics. And those outpatient clinics have outpatient nurses, right? So these clinics are generally not open 24 hours a day. Sometimes you see urgent care clinics, pediatric clinics, your regular PCP, your primary care provider clinics. A lot of those are going to be outpatient. So think about that the next time you're going through or going to see your PCP, is that the nurses that you see there are outpatient nurses. So an outpatient nurse is going to be responsible for essentially all of the nursing duties in an outpatient clinic, right? So you'll be giving immunizations, you'll be giving shots of antibiotics, you'll be giving shots of steroids, administering medications. So you'll be responsible for a lot of the same nursing duties. And specifically what you'll be doing is dependent on what kind of outpatient facility you work at. So for example, if you work at a pediatric facility, obviously you have to have some pediatric certifications, and your scope or the actual activities you'll be doing on a regular basis will somewhat differ from, let's say, a cancer clinic where you'll be doing chemotherapy treatments on an outpatient basis for your patients, right? So there's a difference there in terms of what type of clinic you end up going to, but an outpatient nurse is essentially someone who provides nursing care on an outpatient basis. Now there's some pros and cons to this. This is just my opinion. Everybody has a difference here, obviously, but I'm just going to point out some of the things that I've seen in researching it. One of the biggest pros that I've seen from nurses who are working in this field is the hours. Essentially, for most outpatient clinics, they're not open on weekends, and they're very rarely open into the evenings. Close most federal holidays. They have vacation time, time off with pay. There's generally less stress involved as far as the acuity of the patients, which is a big upside for a lot of people. So, if you're going from a hospital setting where you're working 12-hour shifts at least, and you're in a much more acute situation, you have to deal with staffing issues, patient ratios, a lot of different things like that that are sometimes frustrating in the hospital setting. An outpatient setting wouldn't necessarily have those things. You'll still experience some nursing shortages and some staffing issues, obviously. But as far as the amount of time that you'll have to spend there on a regular basis, or the amount of time that you have to spend there at one point, it's less, right? So in an inpatient setting, you'll generally have 12-hour shifts. In an outpatient setting, you may only work 8-hour shifts. So this is great for people who have kids that are in sports or in school, or people who just don't want to work late in the evening or don't want to work nights. Generally speaking, outpatient will want you to have some experience prior to beginning in their clinics. Now some people have exceptions to this, some people don't, but generally speaking, they do want you to have some sort of experience in nursing prior to having an outpatient nursing career. So just keep that in mind if you're looking into it. All right, guys, let's talk about money. So according to the Bureau of Labor Statistics, an outpatient nurse right now in the United States, on average, can expect to make about $72,000 a year. And that breaks down to about $6,000 a month, or roughly $35 an hour. Really solid pay, and again, when you pair that with the hours, it's a fantastic option if you have any desire to go into an outpatient type setting. Now, one of the subjective downsides that I've seen in looking into and talking to some outpatient nurses is essentially the fact that because it is less acute, you don't generally have the excitement that you would have in like ICU scenarios or trauma scenarios, or ER scenarios or things like that, where you may be a little bit faster paced and you may have that kind of adrenaline type excitement in your job. You won't necessarily get that in the outpatient clinic. Now, kind of the middle ground of that would be in urgent care, where sometimes people do come to the urgent care and it is more acute. But generally speaking, if you go to an urgent care and it is a trauma or it is an emergency, they'll generally just call an ambulance and you have to go to the hospital. So it's still less exciting for some people, which could be a pro or could be a con for you, right? You may not actually want the excitement. If that's the case, outpatient nursing may absolutely be one of those things you want to look into. There is also a category of outpatient nursing that happens inside the hospital, and that's generally day surgery. Now, again, there are exceptions, just like there is in any realm of nursing, where you may have to end up staying later or coming in on a time that you don't generally come in. But for the most part, a day surgery nurse will work early in the morning to 3, 4 o'clock in the afternoon and will not work on weekends. Generally speaking, those nurses are going to be there for the scheduled surgeries, and less so for the traumatic surgeries. Now, again, there are exceptions to that rule, but on a general basis, that's how it works. So recapping really quick, guys, what is an outpatient nurse? An outpatient nurse is somebody who's working in an outpatient clinic. Can be a pediatric clinic, can be a cancer clinic, can be day surgery clinics, lots of different options there. It's essentially someone who is going into work, seeing patients that are coming in for that day, the patients are leaving, and then you get to go home. Generally speaking, there's less hours per shift, and generally speaking, you're not working as many weekends, if any weekends. Now, the downside, again, which may be a pro for you, is the fact that it's not quite as exciting as you might find in an emergency department or a trauma area or a CCU or ICU. You can expect to make about $72,000 a year. Again, that's going to be dependent on where you live. If you're in California, for instance, you might make $120,000 a year. If you're in Texas or Louisiana, you might make $60,000 a year. It's all relative to the cost of living. So keep that in mind anytime you're looking at income for nurses. All right, guys, that's outpatient nursing for you. If I've added any value for you today, hit that thumbs up and feel free to subscribe to the videos. I'll be making more frequent videos in the future. Some of the videos that are coming up are more videos on the 9 highest paying jobs in nursing. And I'm breaking down each of those jobs in this series. So be looking for that. If you have any specific requests, any specific things that you've heard of, that you want a little bit more information in terms of the nursing field, feel 100% free to drop that in the comments. I'll be sure to respond to you and see if I can't make a video for you. Again, if I add any value, hit that like button, hit that subscribe button, and I'll see you next time.